So for
Thank
those of
you.
you who don't know Jen, Jen is a registered nurse, injection nurse. Actually, we go back so many years. People don't know how far back we go. And I found this old picture of us when I was doing my bodybuilding shows and I stayed with you in Hamilton and you were working as like an ER merge nurse. And it was just, you had the craziest schedule and you were just launching your business. You were doing lashes at this point, and I thought it was so awesome that you were, kind of starting that entrepreneur. And now look at you. You've got a hugely successful business. You've got 4 locations in and around the GTA, so Greater Toronto area. So, I mean, just first of all, I'm always so inspired. I think you are such a boss babe. And you are the number one person I go to when I want to know and talk skincare. So I thought, because I work with a lot of women who over the years have shared stories about how their skin has changed during pregnancy and after. As well, I've lately been online looking up different celebrities' skincare routines. And a lot of the moms like Jessica Alba, Hilary Duff, even Cindy Crawford, they'll all say things like, yeah, my skin has changed so much since, having kids and giving birth. And I'm like, okay, so this is a real thing that's going to affect a lot of the clientele that I'm working with, and I'm sure the clientele that you've seen. And as a mom yourself, I thought you were kind of the perfect person to come on to ask a few different questions to in regards to skincare during pregnancy. I think just for time's sake, we'll stick with the during pregnancy today because I have a lot of questions for you. But
I know.
why don't you just tell us briefly how and why you decided to start your business and a little bit about it?
Well, it's interesting because when I first started, I was trying to find a fit. Like once you finish school, you're like, okay, is this really for me? Is nursing for me? Working within the hospital, I loved it. I loved interacting with people of all different backgrounds, ethnicities, and helping. But I felt like there was something else I was made more to do. And I just was missing something. I don't know if you've ever felt that before, where you're going through your career and you just feel like there's a passion for you out there and you're lacking it and you have all this energy. So I started doing eyelash extensions actually before many people knew what it was.
Yeah.
And so I did it as a little side business, just, for fun. It was like my little hobby. And I enjoyed it so much. And I found that, I was actually able to make a little bit of a living out of it, and grew it from my apartment. And I just knew that was where I wanted to be. I wanted to have something of my own to build, and I could help women in another way. And then the credibility of having the healthcare background really helped, and I wanted to integrate the two. And that's why I looked into more of a medical background, and realized as it grew, I couldn't do it on my own. So I have an amazing team of estheticians and injectors that work with me. And I think collaboration is really important, which is what we're doing right now. And I'm so grateful to be here, Steph. Thank you for having
Yeah,
me.
and one thing that I really have taken note of in watching you grow your business is how much you are adamant on continuing education. And I love school, right? but,
I
but
know you're
I love
still in
when
school.
people in the industry are always continuing to learn. And I always see you traveling, and you basically don't have a vacation, you have working vacations. We're very similar in that way, right? And eventually, sometimes we get to have our own vacation. But I really think it's important, and I admire the fact and that you're so focused on that, continuing that even with your team. So that's another reason I wanted to bring you on, because I know you're a wealth of knowledge. And so I think before we get into any heavy questions, I just think I want to ask you, as a mom, and then also as someone who's pregnant right now, your skin is glowing, you look beautiful all the time. What is your skincare routine? What are you
Well, I
currently
actually have
doing?
it all right here. I'm going to bring it all to you right now. So I'm in like the first to second trimester. I'm at the 13-week mark, just went for my first ultrasound. So based on that, that's where I think I am, based on the size of the baby fetus. So right now I'm using SensiCalm, which is a cleanser for sensitive skin. This is a cream-based cleanser, so it's great because I have more dry skin. The product line that I use is Illumier MD, and the reason for that is it's like dye-free, paraben-free, not tested on animals. It's clinically backed. It's physician dispensed. It's got active ingredients in it that are pure, potent, and effective. I also use what's called Bright and Clear Solution. Now, this has 10% lactic acid in it, which some skincare lines actually ask you to consult with your physician about using any actives that are stronger. So any chemical peels or any BHA, salicylic acid, benzoyl peroxide. Those are things you want to just double check with your derm for. A lot of skincare products with topical absorption actually don't get penetrated enough to really affect the placental barrier and the fetus. So, but it's always good to do the due diligence and check. But that's a great exfoliator, and I recommend it to all skin types of women that have that want an extra exfoliation. And then I have Ultimate Boost Serum. This has vitamin C and E in it, and it's a great primer before makeup. So because I have dry skin and I'm applying a product on, sometimes it feels a little bit flaky on my skin. This is excellent. It's light, so it's great for those warmer days like today. So I like to use that on the lighter days. And then I have Illumini, which is a brightening eye cream. This has niacinamide in it, which is a brightener. It helps because in our 30s, we actually start to see aging changes around the eyes. So a little bit of Botox and a little bit of eye cream for moisturizer always helps. I don't have any Botox in right now, but it's still there. I think it is. What about you, Steph? Do you have any movement?
Oh, so much movement.
I threw her under the bus. So I also use Hydra Dew, which is a moisturizer. This one's great for normal to dry skin. Illumia has specific hydrating creams that are specific to your skin type. So whether you be oily, a combination, sensitive red, or dry. And then my favorite for that glow, the final glow, if you're going outside or going to be exposed to any sun, is to use a sheer hydration. Now this one I've had for a long time, so it's kind of like faded a bit, but it's there's tinted and there's untinted versions. I like the tinted because it gives you a little bit of coverage, but the protection is the most important thing, especially when you're pregnant.
Yes.
Yeah, so I do have one more. This is my favorite, Everactive C and E. It is an active. It's got more potent forms of vitamin C and E in it. I like to use this daytime. It's completely pure. It's a serum, so it's light, and it's also great for all skin types, but it can be a bit irritating if your skin's sensitive. But yeah, so I mean, that's the whole line that I use. And it does sound like a lot, but it really only takes me like 2-3 minutes in the morning and at night.
Yeah, and I think developing a healthy skincare line early can really help prevent the quickness of aging of your skin as you get older. And my aunt was always adamant with that with me. She had me on Clinique when I was really young, and she only bought me like dermatologist tested products. And I think people, I mean, as nice as it is to sometimes have like more natural products. I mean, you have vitamin C and E that you're putting on your skin daily, and I use a vitamin C cream in the morning just to brighten up my skin, and I use like an oil at night. But I think a lot can be said for dermatologist tested products, right? Because of the length and the procedures that they go through in testing them. So can you elaborate on that at all? Like what something means when it's dermatologist tested for those people that might not know?
Yeah, so dermatologist tested simply means what it is. It is tested by a dermatologist. I mean, for medical grade skincare, which can be loosely used, it is something that is involved with dermatology testing. But in particular, it's something where you have clinicals that back it up. So not all products that say they are dermatology tested, like some of your over-the-counter brands, actually have clinicals associated with them directly. So that's why it's really important that you make sure you find the source of where that research is coming from, because unfortunately there's a lot of products out there that do have parabens in it, you know, that could be potentially linked to cancer. Not to scare anyone, but it's important to do some research on what you're putting on your skin, especially if you're putting it on your skin every day. With medical grade skincare lines, I believe skincare is a journey, and it's something that needs to be followed with an esthetician or a skilled medical practice that can follow you. And because our skin doesn't always just stay a certain way, it can change, especially through pregnancy, hormones, you know, environmental factors, pollutants, lifestyle factors that are involved in it, and natural process of aging. Your skin is going to change regardless, even if all the other factors stay the same. So that's why
Yeah.
it's really important to treat with prevention, treat with education, and be able to get the sources properly so that you have that educated knowledge to make the right decisions for your skin.
Yeah. And I love that you said that you should work with someone like a dermatologist, esthetician frequently, because a lot of people, like, you go to the drugstore and you buy a product and it says it's dermatologist tested, and then the next month you buy a different product. And so you're always putting new stuff on your skin. You don't know what works, you don't know what doesn't, until someone has a skin condition where they're like, okay, I need to get this treated. Then do they work with one? But I think that's a point that should be said. And I love that you just brought that up, because your skin is your largest organ, right? So whatever you're putting on it is going to get absorbed, and you want to make sure that whatever you're putting on it is safe, and that you're working with someone, just like you'd work with a fitness trainer like myself to train yourself during and after pregnancy or whenever. Like, you want to work with a specialist. And so I think you are one of the top ones in the field. So we're gonna dive into some questions right now. I really want to focus on, though, because I know you don't have a lot of time, skin changes during pregnancy. So what are some things that has maybe happened to you or women that you've worked with, some of your clientele? And what are some ways, if at all, that we can prevent these changes, or maybe just products that we can use in order to help alleviate some of the effects of these changes?
Absolutely. So a lot of common issues with women that are pregnant is that they develop melasma. So specific to pigmentation in the skin from hormonal changes. A lot of our sex hormones like estrogen and progesterone increase during this time. And as a result, not only are like moods affected, but you get these dark spots on your face. Not everybody, some do, some don't, on the skin. So treating hyperpigmentation on the skin is really important. There are limitations to what you can use on the skin during that time. Another change that could happen is acne breakouts. We increase in sebaceous glands, so our skin gets oilier, which increases our risk for congestion of our skin, which increases like the amount of pustules or papules you might see on the skin. I had a breakout up here. I'm lucky though, so far it's been good so far.
Yeah.
But it can happen whether in one pregnancy or the other. For the same woman, you can experience that. Also, other changes that are just physiological and completely normal are, you know, darkened nipples and like, we're all women here, I think, but you can actually get like a darkened like vulva, like the actual vaginal lips get darker, and your axilla, your underarms get darker too. You get that linea nigra, that line that goes from your belly button downwards in that straight line that can develop, usually more so in the third trimester where you start to really notice it. But most of the changes do eventually go away on their own, but melasma seems to be one of the biggest struggles because it can stay with you for years. It can go away, but it can come back. So
yeah, and when I was watching Hillary Duff specifically, she has a big patch actually, and she's like, yeah, this is from having my children, and I was like, wow, like, I always notice like the little dark spots, and she has a very prominent one, and I was very surprised. And so I think it's great that there are some celebrities out there that are actually voicing some of the things that have happened to their body, because otherwise I would have never known. I think most people only find out once they become pregnant. And the conditions you've just mentioned, I've heard from multiple women, but it's very taboo to talk about it. Women don't like to talk about these changes because sometimes they're perceived as negative, right? Because it's a change from what was normal or prior to pregnancy. And so, I mean, the reality that this is a change that happens at your cellular level hormonally. But you know that there could be potential ways that we can help improve it in the future, because maybe what is done can't be undone, but maybe it can be, right? In some regards. So yeah, big thing, stretch marks. That's a huge topic.
Huge topic. I mean, women during pregnancy, or even without pregnancy, men as well can develop stretch marks, and that can be from rapid weight gain. It could be related to genetic factors when you have that weight gain. It could also be the amount of collagen and elastin in your skin, age factors too. So just to summarize, stretch marks are something that can occur on the dermis, not your most superficial layer, but a little bit deeper, right before the fat. And what happens is, as we stretch, our connective tissue loosens and we create these lines in the skin. Some people present with these like white stretch marks. You'll see some with the red and purple. The red purple just indicates that there's blood vessels underneath that are more visible from more severe stretching. As a result, it does, when we lose the weight back, you'll still see the stretch marks. So it can be a real struggle because there's not a lot of solutions out there to fully treat a stretch mark to get it gone completely. But we do have options like in our clinic that we offer that can help. Did you want me to talk about the treatments?
Yeah. No, because until you had told me about it, I was like, wow, I didn't even know this was a thing, but it makes sense.
Yeah, there's so for stretch marks we offer something that is not very common in Canada actually. It's we brought it in last year. It's called camouflage stretch mark. One of our owners, our partners, Amanda, she's a medical esthetician, and she's a true artist. She has brought this treatment back from Brazil. She went to Brazil directly to train one-on-one with Fernanda Jaffra. She is owner of Studio Inc. And she helped to develop this technique that uses tattooing on white stretch marks to fade them. So the appearance of it. So it hides the stretch mark. It's gonna not take it away, but it's gonna fade it, soften the line so it becomes less visible. And that's something that can last for life. So, but with multiple treatments leading up to it. So it's excellent.
Yeah, I thought that was so cool. Sorry.
That's one of our favorites. We have a couple other ones. One of our more popular treatments is called microneedling. I don't know. Have you heard of it, Steph? Have we talked about it?
Yeah, I've seen some posts on your social media, which is fantastic. I love your social media. I'm always learning stuff. I'm like, I didn't know this was a thing. But yeah, talk about microneedling.
Okay, so with microneedling, we use a pen-like device. It's got sterile needles on it that penetrate the skin. And as a result, this injury stimulates collagen and elastin. It promotes healing in the skin. So when our skin is triggered to heal an injury, we actually tighten it again. So it's great for fading stretch marks. We have tons of before and afters on our website too. And if anyone wants more information, they can always private message me. But it's one that involves a series of treatments to fade it gradually. So one of my favorites, I mean, it's affordable. Usually 4 to 6 treatments is ideal. But with all skin treatments, especially with stretch marks, we have to go slow because skin is gradual. There's nothing immediate about changes in skin without patience with any skin condition. So very popular and great for all skin types. The nice thing about microneedling also is it's great for doing in the summer because lasers are another alternative. But unfortunately with lasers, there's a risk for burning the skin, which can cause risk of scarring and further damage to the skin. So I always look at safety as a huge factor in determining the treatments for our clients. So definitely an option.
Yeah. And actually good point on that. So most people are staying in a lot or have been for the past month because of quarantine and because of everything that's going on. But, you know, summer's around the corner. People are getting ready to go outside. So what are some things that people can do now so that when we reemerge, whenever that is, that we look our best and we're feeling our best? Because most of us are not able to go outside, so we're not getting vitamin D. We still want to be protected from the sun as well when we go out. But like, what are some, you talked about your skincare line. Is there anything else we can do? Or are there ways that we can look better on camera for all of these Zoom meetings and calls that we're doing?
Filter. No, I'm just kidding. There's no filter right now. But I do have these magnetic eyelashes that I've been like really liking during quarantine. Like, I mean, they don't compare to actually getting eyelash extensions, but they, you know, they do help in the meantime. So it's good. We don't sell them, but if you're interested in them, I have the link for you. But in terms of like maintaining and preserving the skin, the number one advice I can give you is, unfortunately, to stay out of the sun. It's beautiful today, but sun and smoking are probably your 2 factors that will speed up your process of aging. They will dull the skin, they will turn it gray, and it's not good for your health in so many different ways. But important to wear sunscreen, broad spectrum sunscreen, which covers you for UVA and UVB rays. And we do carry those. The nice thing is you can order it online, have it shipped directly to your house. And then, you know, wearing a hat, minimizing exposure, reapplying your sunscreen every 2 hours, especially if you're pregnant, because there's not a lot of other options you can do aside from like prevention. Because after you're pregnant, the pigmentation fades. You can look at other options that are more aggressive and more potent that you can treat safely without worrying about the fetus or transfer into the breast milk. But yeah, so that would be my number one thing. The other thing is vitamin C and E. Vitamin C and E is great to apply. It stimulates your collagen elastin. Yes, you can't do microneedling right now, but that's something, you know, hopefully we open soon and we can get you back in.
Yeah.
So proper skincare. And actually, I think we're noticing a lot more in sales and skincare now with the quarantine. So that is something like positive about this, is that people are really focusing on what can I do at home? Whereas before, when we were open, it was easy just to come in for a clinic appointment, but not maintain at home.
Yeah.
And you really should be doing both.
Yeah,
right?
definitely.
It's like going to the dentist and then never brushing your teeth at home, right? You're not doing the other half of the proper maintenance.
Yeah, definitely. And even, I mean, we could talk about even diet and how diet can affect your skin, but that I feel would be like a whole other hour-long conversation. So
right?
We're not going to go there. But no, I think that's really helpful. And I think, again, a lot of people need to kind of hear that, because sometimes, I mean, there's so much to do. And if you're a full-time mom, which a lot of the women that I work with are, you know, the stay-at-home moms right now, while also working, if they're back at work, while also maybe being pregnant. So it's a lot. So, I mean, your skincare routine, you said, takes what, 2 minutes?
2 minutes, morning and night. I mean, you just need to make a routine out of it, because it's just like how many people actually floss their teeth? Like, we know to do it. It doesn't take long, but it's real struggle. If you can try to incorporate it, just like exercise, daily into your routine, then it becomes a lot easier. It becomes second nature, it becomes something that needs to be done. I know that's, for me with exercise, it has to be a routine, or else it doesn't get done, right? And that doesn't take long.
Yeah, even flossing is so funny you said that, because
like, do you floss your teeth?
My sister said this to me, and then I've never stopped flossing since. Every day I pretty much do it, unless I randomly forget. But she said, floss the teeth you want to keep. So when you're old,
just the front,
do you still want to have? So like the front ones are always flossed, and I try to get back into the back. But I think the same can be said for skincare, and I think I'm glad that you said that, because we should be developing a skincare routine. And it's never, is it too late, or is there never too late to?
It's never too late, but your outcomes are better when you start earlier. Prevention is a lot easier to do than to treat someone decades later. But regardless of when you do it, you're going to benefit your skin. The thing is, we deplete in a lot of things like collagen and elastin in our skin. Hyaluronic acid content that holds hydration in our skin depletes over time as we age. These things help us to replenish. Injectables can help to replenish, like your fillers too, because we lose that volume, right? So it's about maintenance. It's not about adding something you never had. It's just preserving you so that you stay you. Yeah.
Definitely. Okay, I've got some rapid fire questions about some of the procedures you do, because like I said, before you, I didn't know all of these things existed, and I didn't know what they were. So you have 30 seconds to kind of explain to the audience what these things are. Okay, so the first is the vampire facial.
Okay.
What is it? Ready?
Okay, so vampire facial.
Go.
Okay. Oh, you're timing right now. Okay. So vampire facial is a collagen synthesizing treatment. It's a medical grade facial. We involve your platelet-rich plasma, which is extracted from your blood, just like normal lab work. That is taken, spun through a centrifuge, and then we isolate your platelets, which are yellow fluid, and it's injected into areas that we want to treat to rejuvenate the skin. So a lot of people use it around the eyes, you know, smile lines, any fine lines in the low face. We actually distribute it topically everywhere and then inject it into those target zones. You're red for like 2-3 days, but once that resolves, your skin starts to glow, and the results are improving in your skin over the next 6 weeks. Did I do it?
Yeah, you're 40 seconds. That's okay.
Oh, damn.
I think the next one will be easier because it's a similar procedure, but that just blew my mind that you're like, we take your blood and then separate the platelets and re-inject it back in your skin. I was like, what?
Yeah.
Okay.
Don't worry. It's all done in a sterile environment. Yeah.
Yeah.
So it's not that you like mix it and take it out. And so it's very sterile.
Yeah. Okay. Next question. What is the OShot?
So the OShot is a vaginal rejuvenation treatment. This helps with tightening and strengthening the bladder from it weakening over time, especially from pregnancy. This is also used to sensitize the clitoris and the front wall of the vagina to increase sensitivity to our G-spot. It's great for women of all types, young, old, those women that have not had babies, those that have. We use platelet-rich plasma also for the injection. So it's a very safe procedure because we aren't using any medicated products. It usually involves 2 to 3 injection points, and most people don't feel a thing because we ice, we numb with lidocaine, and we inject lidocaine as well prior to the treatment.
Awesome. That one was better. That was 38 seconds.
Okay, get quicker.
Okay, I've got one more question, and I just found out about this product recently because of you. What is INV?
Okay, so INV is a serum that helps with lash growth for lengthening and thickening the lashes themselves. It's great for all skin types as well. Not recommended for someone during pregnancy and breastfeeding, but to be honest, I use it. But that is up to the discretion of the individual and their doctor. It's not medicated at all. It just has peptides in it. It's got grapeseed extract. Its main component is actually water, but it is really, really popular and it works. Usually within 8 to 10 weeks, you will see results.
Yeah,
if you use it
I'm excited because I've been using it for 2 weeks now because I used to always have lash extensions, and because of this, they've all come out, and you were the first person I messaged. I'm like, what can I do about my lashes? So
INV. Get it.
Yeah, so thank you for sending it to me because I'm really excited, and hopefully if we should do a follow-up, I think, to this because I know you have to go, but hopefully when we do the follow-up, maybe I will have some proof or evidence right now because they're so small.
I know. Close your eyes. Look close.
Oh, it's so funny. So funny. Yeah, but no, I know you have to go. I know you're so busy. You've got so much to do still. So before we go, though, I just wanted to find out, or if you could share a little bit more information with the viewers about the skincare club that you guys offer, who's it for, and where can we find more information about you, the products you offer, the services your team has. So let's start with the skincare club.
Okay, Skincare Club is a club for those who are dedicated towards improving their skin because skin is a journey. So with this club, it involves one educational class per month, which is sent through a private link for you. The club itself is run by Amanda. She's our Monaco skin guru, and you can find her link on her bio on our website, monacospa.ca. In this skin club, you also get a facial per month, or actually 2 facials a month. The description is actually on our skin club, which is under services on our website. So we'll be able to break down specific facials for the skin club members. And those include hydrofacial, it has dermaplaning, chemical peels, a red carpet glow peel. So there's a lot of different options. Even microneedling's on there. Our LED blue light treatments are on there as well. So if you check it out, it's nice because you get a custom esthetician with this knowledge and skills to guide you through exactly what you need throughout the entire year. Yeah, it's a membership.
Awesome.
Skin membership. Yeah.
Amazing. Okay, and last question. How and where can we find you? What are your social media handles? What's your website? Where are your locations?
So we have 4 locations, all aesthetic boutique clinics in Hamilton, so Ancaster specifically, and Stoney Creek. We also have our Burlington location right on a block away from the lakeshore, a beautiful little location run by a nurse named Monaco. The one in Stoney Creek is run by Monaco Skin Guru, where our skin club is exclusively out of. And then we have our Mississauga location, which is run by corazoncosmetics.monaco. She's you can follow her on our Instagram. We have links to her directly. That's Nurse Nicole. So that one is right by Square One. And then I'm in Ancaster full time. But that's where you can find us. Our Instagram is at Monaco Medi Spa. So whoever is following us right now will know. And then our website is monacospa.ca. But you can just Google us, Monaco Spa, and you'll see it come up. And click on our links, and all our information is there for you.
Awesome. Well, thank you so much, Jen, for joining me. This was so fun. It's so great to see you again, too. Like, it's always cool connecting with old friends at this weird time, but also being able to like chat and share information with everyone. So really, thank you so much for your time. And let's plan this again for maybe 2 months from now. We'll do a follow-up for the postpartum women out there. All right.
Absolutely. And then if anyone's interested in a specific topic they want us to discuss, whether it be health, fitness, diet, beauty related stuff, I think Steph and I can cover all the spectrums. For anyone that just was tuning in, Stephanie does a lot of she's a professor actually with the Western University. She travels a lot for education. She specializes in fitness, postnatal fitness, exercise, health, diet, anything you name it. You can follow her at Stronger Fitness. She's a good friend too. So thanks everyone.
Thank you. I've never had a guest actually give me a plug like that, so that's amazing. Thank you.
Put it in there.
Yeah, no, that's great. Anyway, enjoy the rest of your day, Jen. Thanks again so much for coming on, and we'll chat soon. I can't wait to connect again.
Sounds good. We'll see you later.
Bye now.
Bye.